So I'm very passionate about the rhinoplasty procedure, and we have been doing this for many years now, and we are getting very good results, and we are getting patients from all over world and different states of India for especially for the rhinoplasty. Rhinoplasty is not only for changing the appearance of the nose, so we can treat the breathing problems, we can correct the functional problems with the septoplasty. So I am trained for the septoplasty and for the rhinoplasty, and it is always done under general anesthesia. It takes me 2 to 3 hours. So what are the advancements in the rhinoplasty? Because over the time the technology has evolved, our experience has increased. So most important is using the spreader grafts, because the middle of the nose, whenever we do open rhinoplasty, we don't want to make it a pinched nose, so we always use the cartilage harvested from the septum to use it as a spreader graft. And second, the most important is the columellar strut, because the nasal tip, it droops after the surgery, so we want to put a cartilage as a inside the lower part of the nose, so the tip should be always in a good lifted position. So using of these cartilages are very important. So never opt for a rhinoplasty if your doctor is not using the septal cartilage as a spreader graft or as a columellar strut. And other important things are in the osteotomies. If we are narrowing the bone, so there is this experience of the doctor, we can do the traditional method, or we also do the pisotome for rasping of the bone and for narrowing of the bone. And the most experience is required for the nasal tip modifications. You want to narrow the tip, you want to rotate the tip to a higher level, you want to align the tip in the proper position, so with certain sutures or with some trimming of the cartilage. So sometimes the cartilage is very big, so you have to under project it, you have to remove the part of the cartilage. Sometimes the nasal tip is drooping, you have to add the septal cartilage. So all these techniques are very important, and believe me, these should be done by experienced plastic surgeon who is passionate about the rhinoplasty surgery, because nasal tip modifications are very crucial for the look of your nose and the base of the nose. So changing the shape of the nostrils, the alar trim, the nasal sill surgery, again these are the part of the advanced rhinoplasties. So using of the septal cartilage, again there is a septum inside the two nostrils, there is a wall inside which is made of the cartilage. So a surgeon should be able to harvest the cartilage, because in most of the cases we need to add it into the nose to make it a stronger looking. And sometimes we also dice the cartilage, so we make a small pieces or a paste of the diced cartilage, so we can give you a very good dorsum which is even. We can reduce the height, we can there can be some areas of elevation and depression in the end of the surgery. We use the diced cartilage to nicely carve or nicely hide whatever irregularities are there. Experience of the doctor, you should see many before after pictures. So if any client comes to me, so we can show almost 100 cases of before after picture, 100 cases of video testimonials. The patients, they are speaking, we can provide you the contact numbers of the patients, and they are very happy to speak about us, because we have changed their lives and they become my friends, because they always thanks me for their new look. And now another important is the preservation rhinoplasty. So we preserve the important ligaments and the muscles in the nose. There are special trainings, international trainings for that. So earlier we used to see a lot of swelling, a lot of bruising associated with the rhinoplasty, and now the downtime has reduced only to 1 week. Even I have done many rhinoplasties in which we got the result in just 4 to 5 days. the patient is happy, we remove the splint. Best reward is the smile on our client. So I am very passionate to do the septoplasty and the rhinoplasty. It should be always done together. So you have to just give us a call. We will ask for your pictures, and we will advise you on a telephonic conversation what best can be done. In few cases we might need some investigation, otherwise we have certain nasal scopes we can easily visualize when you visit to the clinic. So we usually call our client 9 o'clock in the morning, empty stomach. Then I spend half an hour taking the pictures and discussing on a bigger screen. Then the surgery is done under anesthesia, and we will send you home in the same evening. Then I want to see you after 2 days, then after 7 days. And in most of the cases, the 7 days or 1 week is enough for healing, because of our instruments, they have become smaller and advancement has become more. So there is very less downtime, there is less chances of the swelling. You can do anything at home. You can move around, you can watch a movie, you can talk on mobile, you can eat anything, you can go out for a ride. But there will be some dressing on the nose, so you should not have any function or out of social life for 1 week to 10 days. Thank you.